Yeah. So, well, if you back up and look at the human body, and a lot of things are just estimates, so give or take, but they say we have about 60,000 miles of vasculature, like blood vessels in the body. 60,000 miles. And you're like, how's it even possible? Because a lot of these are microscopic, or what you called microvascular, right? They're really tiny. They're capillaries. They're really small. And you're looking about 97% of that 60,000 miles is this microvasculature, these really tiny, if you will, blood vessels, capillaries. And so that's what most of the vascular, as far as length of the blood vessel, is made out of. So it's, 58,000 plus miles of these microvascular blood vessels. And what happens, so the blood flows through the heart. Be careful not to use the word pump. Flows through the heart.
Thank you.
Out the arteries, and basically it's a thicker branch to a tinier ones. It just branches off like a tree and gets to really small ones, and that's it's carrying oxygen, the red blood cells, and it's doing it slows down the farthest point away from the heart, slows down, pretty much almost stops the red blood cells, shimmies back and forth, releases its oxygen, then gets picked up by the venous, capillary. Some red blood cells, sneak through, get picked up by the lymph, etc. Like, this plasma, if you will, that's in that is blood, essentially blood plasma. And in this process, when we have traumas, so we are exposed to mold, we drink some radioactive elements in our water supply, we, get exposed to glyphosate, some herbicide or environmental toxin. These toxins basically damage, and what we know from literature, and this goes back a while ago, as you heard on the webinar, is that it causes leaky blood vessels. And the leaky blood vessel is in that tiniest spot, the capillary or the postvenule. And so if the blood vessel is leaking, that means that it can't keep all the fluid it needs into that blood vessel and keep it moving back to the heart, venous supply back to the heart. So if it's leaking, where's it leak to? And it leaks into the connective tissue. It leaks into the extracellular matrix, depending on the names you want to say, right? Fascia. It's all this basically the same thing, just depends on the terms you want to use. So it leaks into the connective tissue. And that's what causes overburdening of the lymph, where the lymph has to drain all this extra stuff that's leaking out. And then proteins and these other things sneak out of the blood vessels and get into the tissues. And when they do, then it starts causing dysfunction. It starts causing inflammation. It starts lowering the oxygenation of the cells. And so all these different processes happen within the body to try to deal with this.